Good morning. It's good to be with my friend Christine Hogarth here in Etobicoke at Staples, really just trying to highlight the importance to young people and to families to get their supplies ahead of the school year, and I really want to thank Staples for making it safe and accessible for parents. We know how important that is to get their backpacks ready on the eve of back to school. And for Christine and I, we're just very excited, and we're extremely inspired by the incredible resolve, the courage and the hard work of our school educators, our principals, our administrators, and the students themselves, who overwhelmingly are eager and excited to get back to learning with their peers in a safe space. And we have worked so hard throughout this pandemic to ensure, as a province, as a society, we do everything humanly possible to reduce the risk. As a collective, we've seen a reduction in community transmission, but we still have more to do, especially for that under 30 constituency of youngsters we've seen an increase in transmission. We all have a duty as a society to adhere to public health advice, to distance, to mask, to hand hygiene, and for private enterprises like Staples to do as much as they can, as they clearly are doing, to mitigate the risk for their clients and for families across the province. And so if we all do our part, our kids will be able to learn. And I want to really emphasize that over in the next coming days, because I think we have a collective responsibility. And if we continue to follow public health advice, we can flatten this curve, and we can ultimately ensure that every school in the province, urban and rural, is safe. And so we just want to reaffirm our focus on the safety of children, on our staff, with a very strong, robust outbreak management protocol. And again, I just want to thank our students and our educators, our administrators, for doing so much, working so hard, and for being so mission-oriented and ensuring that kids can get back to school in a safe space.
Minister Lecce, you talked about community transmission. We're already seeing in certain communities, like the Jane and Finch area in West Eastern School, there's been a case there. It's just right before the start of school.
Right.
Are you not concerned that there's going to be massive spikes when kids go back to class?
Well, what we have known is there's been an increase in transmission in the northeast, northwest of Toronto specifically. Those are sort of the in the heat maps where we see problems. And that is specifically where the province, working with the Toronto District School Board, the Toronto Catholic School Board, has allocated more resources so that there's more distancing, fewer kids in the class, and additional enhancements being made in those very schools, because we recognize the causal relationship of transmission in community and the potential for outbreak in a school. That's precisely why we took action in those particular areas, and we're going to continue to take a triage approach to where the greatest risk is. We'll continue to put more resources just to reduce the risk for the kids and those staff members, and ultimately for the community, because we want to see that trajectory obviously go down.
And also in some of those hard-hit areas, out of the TDSB identified about 81 schools that are the hardest or the highest risk rather, and in 32 of those schools there's less than 50% of the children going back. It kind of just shows that a lot of the parents are concerned with the province's plan, and a lot of them we're speaking to said they want smaller class sizes by the province not doing that.
Well, I mean, look, I don't presuppose the rationale for hundreds of thousands of parents. Some have, I won't. Many parents have aging, they've got their grandparents at home, they have, immunocompromised siblings. I mean, there's a variety of circumstances why an individual wanted to do that. Keep in mind, in our province, uniquely, we have positioned Ontario to actually have a credible online learning program, which no province is offering. So the fact that they have a choice is unique to this province, in addition to the fact that I have mandated school boards to allow a parent to start at home, online learning, and to re-enter into schools at a later date when they are comfortable. And I think that's a strength, to be quite frank, that we're giving them that choice, that latitude. I'd rather parents make that decision than government. In Quebec, they've mandated every child has to go to school. It's a mandate. We've given parents a choice. And at the end of the day, in those very areas of higher risk, we've worked with Toronto Public Health, the school boards, and of course with the command table, the COVID-19 command table in the ministry, to make sure that more public health nurses are deployed and allocated in those various areas of vulnerability. So we are doing everything from enhancing cleaning to obviously hiring twice the number of public health nurses in our schools. We've got a very strong testing protocol, an outbreak management system that is being led by Dr. Heyer, who is a leader in this respect. We really do believe our program is strong, and we like childcare. Over time, we'll build confidence. The first time, I know when I spoke to parents who dropped off their child, the first time when they dropped off their child to a childcare center, I know that was a very nervous moment, and it was perhaps for many days thereafter. But over time, when they got a sense of comfort with the system, with the professionals and the staff, the training and the protocol, the very robust health and safety protocol, I know that angst could dissipate. So we're just going to continue to build confidence by doing everything we can according to public health to mitigate the risk. It's why this province uniquely is leading the nation in the context of masking, with the most comprehensive masking protocol. You cannot enter a school, grade 4 and up, without a mask. We're the only province to have that in our classrooms. And likewise, we're the only province to have public health nurses within our schools. Likewise, testing protocol, asymptomatic testing for high school students. I recognize that angst is out there. We all have it. Uncles, aunts, parents, grandparents, we all share that. We all have skin in the game, and we just want to get this right. And so that's why we're going to continue to work very closely with the medical community to make sure that every child and every staff member is safe in Ontario.
Minister,
yes.
Frontliners has shown that there are different social classes, different. Less economically endowed people are affected the most.
Yeah.
When we look at the surveys of who's going back to school and who's not going to school, people in the higher socioeconomic area will have a higher percentage of kids going back to school. When you look at lower income, they have less likelihood. So they're going to be having less education. Is your message enough to get the less educated people into schools and to reach out with them through the surveys? And should we reach out even more and tell them that it's going to be a safe environment?
Yeah, we have undertaken over the past many months a plan to build a public health protocol that is safe, that is comprehensive, and that leads the nation. And I think in lower income communities, most especially, from an equity perspective, we have not lost sight how important it is there to make sure that those children have equal opportunity, access to an educator, access to technology, computer, internet when required. I mean, we have increased investment in technology because from an equity perspective, I understand very much how not having a computer could create a varied experience for those children. It's unfair to them that they don't have that choice. So we have invested $15 million more to procure in and around 30,000 plus new computers for school boards. School boards have over 200,000 tablets out as we speak, and many of which have internet. The province negotiated a deal with Rogers and Apple to produce a low-cost, high-impact solution. So we know there's more to do, even from a mental health perspective for those children. We have dramatically increased the investment of hiring of more psychologists, more psychotherapists, social workers, therapists for those very children that face greater levels of risk, social isolation and challenges. And we're going to continue to be there for those families, most especially. We don't want to compound the challenges they face. And we're going to be there, including for our educators, by providing them with the best professional development. Many of them have already undergone that at the board level. The ministry is now mandating professional development with a mental health focus, a racial and discrimination focus. The fact that a training protocol that includes race, anti-racism and discrimination elements, as well as mental health. And together we think that will really help position our educators that are in the classrooms to mitigate that experience and just to help every child, particularly from lower income families.
When you have an area like the beaches where their school attendance is going to be around 80%, and you have another area that isn't as strong socioeconomically, and they're only going to have 50%, you can be surprised by Tuesday night, and people get surprised just and have more kids show up, or are you worried that these aren't the people kids aren't going to show up?
We'll know in a few days what the decision point of parents is. I have confidence that they'll make the right decision for their family, knowing that the province has a health and safety protocol that is comprehensive, that is evidence-informed, and that ultimately is going to keep every child safe. And the obligation that the Premier and I have made very clearly is we will do whatever it takes to keep kids safe. It's why we are investing $900 million in a one-time allocation just for this September And there's more money coming, another $340 million coming in January. We have $50 million set aside to deal with influenza and any other issues that arise this fall. We'll do anything and everything to keep kids safe.
And there's employees that have tested positive already. School doesn't even open for them.
Right.
How does the minister react to that, and how are they ongoing?
Yeah. It underscores the necessity for all of our staff in our schools, likewise anyone entering them, to undergo the screening process, which is vigorous. We need them to do that, and likewise to self-assess if there's any issues, any symptoms, the importance of staying home, and likewise getting tested, consulting medical advice, and of course adhering to the broad principles of distancing, masking, and hand hygiene always. I think what the broader point is that we have to remain vigilant. And the fact is, we have seen in our communities, positive cases over the past weeks, and we have to do our part as a province. We've got to redouble our efforts now more than ever to ensure that children can go to school by keeping that positive transmission low. And that's the obligation we have to the next generation. And I know every person in this province is up to the task. They have incredibly done that since the beginning of this pandemic. It's why Ontario, from a continental perspective, leads. We have some of the lowest rates for a large province, large jurisdiction. And I'm really proud of the people. I'm inspired by them. I just am appealing to them to continue to do everything they can in their power to mitigate the risk for them, for their families, and of course for our kids.
My question is about school supplies and about supplies in schools.
Sure.
So there's, these boards are creating a whole bunch of different, guidelines and recommendations as to, if things are shared, they'll be disinfected by teachers and students, and then, certain things need to go in boxes, or, quarantine for 7 days with books. One teacher told me, kids aren't allowed to touch books at all. So, how realistic is it to, start putting all these asks and, putting all these guidelines on teachers, monitoring all these supplies, all this stuff?
Is that the new classroom over there, the shipping container?
And
My son's JK class is 27 kids.
Sending a realistic.
How do you feel about that?
How realistic is it for students to not share and to not touch, and for these things to get disinfected in between use?
I appreciate that the health and safety protocol outlined by the Chief Medical Officer was informed really based on mitigating contact. And so what you've seen in childcare centers and likewise in elementary schools is a lot of materials have been moved out of the class. Anything that is not easy to disinfect, easy to wipe, has been removed. Most educators have already done that. And that's based on the health and safety protocol of just really trying to minimize transmission. So I appreciate, obviously, the challenge. This entire pandemic creates so many logistical and operational challenges for educators, likewise for parents, for childcare staff as well. But we obviously have confidence that by removing those products, removing those materials, decluttering the classroom, having clear training of the staff, and likewise training of our educators at the beginning of school, that should change the behavior of our staff, likewise of our kids, and just do everything we can. I appreciate it's going to be a little different this year. I understand that. But I think parents expect it to be a little different, expect it to be a little safer, a lot safer. And so those types of changes are really premised on that basis. And obviously it's going to take time to readjust, but I have confidence that students, likewise educators, are going to do that.
Last question.
Quebec is 1 week into
Yep.
the school year. They've got private and public schools reporting 47 COVID cases.
47.
47
COVID cases at 47 schools.
Understood.
47 schools. What concerns does that bring to us?
Well, I think it underscores the necessity of self-assessment for every parent at home before their child gets into a school. They've got to take that assessment. And I know parents make those decisions already in the context of influenza last year and in the years past. But now more than ever, I would argue a cautious approach, not sending a child with any symptoms according to that COVID assessment tool that we provided for parents, is step one. Step two is to make sure that when these challenges manifest, that they arise, that the schools have a strong outbreak protocol in place. And in our case, we have a doctor that's leading it, Dr. Heyer, under the leadership of Dr. Williams, the Chief Medical Officer, that will immediately act, immediately deploy resources, and make sure the local public health authorities are in there, supported by the fact that in this province, we are doubling public health nurses in our schools, which are going to add a material advantage because, respectfully for our educators and principals, they're not doctors and they shouldn't be put in that position. So if they could be supported by medical practitioners, it's going to help them make those decisions and ultimately ensure that the children are safe. But as I said, broadly speaking, when the risk enters our school, it's a product of the transmission in our community. So we have to, as a society, as a province and country, do everything humanly possible to keep that risk down.
Speaking to this 47, what would that mean for us? You know what I mean? 47 is a lot of schools. What's the big?
Yeah, we've taken a very different approach to our reopening. We have staggered our reopenings. We have designated boards with higher risk. In high school, a maximum of 15 students. We have mandated masking in our classrooms, which Quebec has not. We have obviously public health nurses, which we're doubling. No province is doing that. We have unique differentiators in this province that they do not. I wouldn't draw a parallel. Not all things are equal. We are uniquely positioned to respond. We've got the assets and a clear protocol endorsed by the Chief Medical Officer. What I would simply say is when those challenges arise, as they have in businesses, in childcare and other places, we will act decisively to keep every child safe. Okay.
So you're saying you're hoping it doesn't go that way. You're hoping that we're not going to have that many. Based on
I'm suggesting that we are ready to respond when and if that challenge arises, and we as a society can prevent that if we keep community transmission low, if we do our part, follow public health advice, and ultimately just do everything we possibly can to enable children in September and beyond to go to school. Thank you so much.
Thank you.
Appreciate it.